Hi, I'm Dr. Tim Babineau, Lifespan's President and Chief Executive Officer. This won't be the last time you hear me say that medicine is a team sport. And no matter where you work at Lifespan, whether you work at the patient bedside or provide support services, you're a valuable member of this incredible team. Of course, like every team everywhere, we all must play by the rules. And in this case, rules and regulations primarily determined by our federal government. These rules range from confidentiality of patient information to billing and claim practices to laws protecting your rights as an employee. It's a lot of information to absorb, and to make sure that everyone knows and understands the rules, we have a system-wide corporate compliance program. This program includes a code of conduct, general compliance policies, and employee training. To minimize our risk of violating federal and state regulations, we conduct internal monitoring and have established a response line that allows employees to report potential violations. We encourage everyone to speak up if they believe a violation has occurred. If it turns out that we weren't in compliance with the law, we'll make all changes necessary. If it turns out we were in compliance, no harm done. No one is penalized for reporting a potential violation. I can't stress that enough. We encourage staff to use the employee response line because healthcare fraud continues to occur across the country. And at the same time, government regulations are complex and constantly changing. So please, if you see something, report it. Your support is vital to the success of this very important program, which ensures we are living out our common vision and values on a daily basis.
The mission of the Lifespan Corporate Compliance Program is guided by the Lifespan mission of delivering health with care. The Corporate Compliance Program's mission is to create a culture of system-wide compliance with all applicable laws, regulations, and Lifespan policies, as well as an appreciation for privacy awareness. The compliance function is a resource to all employees and physicians, using a collaborative approach to navigate compliance concerns. To accomplish this mission, the program sets forth in policy reasonable methods for the Lifespan community to follow to achieve continued compliance. And it aims to resolve detected violations in a fair, ethical, and consistent manner. For example, it requires all employees, managers, and professional staff to report suspected violations or improper business practices to Lifespan leadership or the Lifespan Corporate Compliance Office. The program includes oversight by the Board of Directors and Executive Management, provides communication of compliance and privacy rule standards and procedures to all employees, and creates reasonable methods to continue to achieve compliance. The program also establishes appropriate and consistent responses to address compliance violations. Why does Lifespan need a corporate compliance program? It is consistent with Lifespan's philosophy of doing the right thing, and it ensures that all Lifespan entities will continue to provide superior care. The program turns potential crises into manageable problems and reduces Lifespan's exposure to criminal and civil liability. Newspaper headlines show the importance of compliance and the financial consequences faced by healthcare organizations that do not comply with state and federal regulations. However, healthcare organizations that make a good faith effort to prevent, detect, and report violations through their compliance programs face reduced fines. Key components of Lifespan's corporate compliance program are the Code of Conduct and more than 70 compliance and HIPAA privacy rule policies. The Code of Conduct defines and reinforces Lifespan's commitment to complying with all laws and professional regulations, and to reporting all violations. Examples of issues addressed by our compliance and privacy rule policies include conflicts of interest, interactions with pharmaceutical and medical device vendors, and vendor-sponsored entertainment, gifts, and training.
To ensure that Lifespan complies with federal fraud and abuse regulations, we have established a strict code of conduct, conflict of interest disclosure process, and rules that govern how our employees and physicians interact with sales representatives. For example, Lifespan employees and physician staff cannot receive anything of value for making a purchase decision or ordering any good or service. Gifts are not acceptable. These rules are intended to protect our staff and our entire organization.
Practices designed to ensure the confidentiality of patient information, to protect patients from unauthorized photography and video recordings, and to limit access to patient information.
Lifespan patients expect their healthcare information to be kept confidential. To protect our patients' privacy, Lifespan employees and physicians should not discuss patient health information outside their work site or access medical records unless they have a treatment, payment, or healthcare operations reason. Lifespan has established procedures to ensure that only authorized employees with the need to know gain access to our patient information.
False claims, waiver of copayments, healthcare billing, and claim submissions.
Lifespan has instituted multiple policies, procedures, and system edits to reduce the risk of submitting false claims arising from billing and coding errors. For example, to reduce the risk associated with inappropriate coding of Medicare or Medicaid claims, we have validation procedures and software in place to assure the codes we use are correct and are assigned based on medical record documentation.
The management of research grants and contracts, research misconduct, and research conflicts of interest.
Lifespan has a robust research program. We conduct our research in accordance with the highest professional and ethical standards. We've instituted policies and procedures to protect the rights and welfare of research participants and to foster a research environment that discourages misconduct, including establishing a research conflict of interest program, requiring informed consent, and providing relevant specified training. These practices help preserve our integrity and quality of our research.
Text replication, clinical conflicts of interest, employed physicians and other providers' sanction policy.
Lifespan expends considerable effort to teach our professional staff documentation and supervision requirements put forth by Medicare. From an education standpoint, our message is that if it's not documented, it didn't occur. Complete documentation is what enables us to better communicate amongst ourselves and with all providers, leading to better quality of patient care.
Compliance with physician recruitment rules, the Fraud, Abuse, and Anti-Kickback Statute, and the Stark Patient Referral Law.
Lifespan requires that all financial arrangements between Lifespan and a referring physician fit within an exception or safe harbor under both Stark and the Anti-Kickback Statute. The application of federal and state referral laws generally requires a complex legal analysis. For this reason, administrators are strongly encouraged to contact either the General Counsel's office or the Corporate Compliance Officer before entering into a compensation arrangement with a referring physician.
Compliance with environmental laws, equal opportunity employment, and the non-hiring or retention of sanctioned individuals.
Medicare sanctions individuals such as physicians, nurses, and others, as well as vendors who break federal rules. Lifespan will not hire or retain these individuals, nor will we enter into business agreements with sanctioned vendors. On a regular basis, Lifespan checks the Medicare sanction list to ensure that we comply with this very important rule.
Patient privacy monitoring, breach of unsecured patient information, confidential communication of patient information.
Lifespan has established standards to safeguard the confidentiality, transmission, and integrity of electronic medical records. Such measures include never sharing passwords, encrypting laptops, flash drives, and other portable media devices, and detecting and avoiding phishing emails and other cyber threats.
Code of ethics for senior executives, sexual harassment, substance abuse, and a drug-free workplace.
Substance abuse can have a devastating effect in the workplace. Lifespan prohibits the use, possession, or distribution of illicit substances while engaged in Lifespan business. Disciplinary actions can range up to and include termination. Any employees finding themselves with substance difficulties are encouraged to contact the Employee Assistance Program for further help.
Lifespan complies with regulations regarding patient privacy. For example, the patient's right to restrict the use and disclosure of medical information and to inspect and amend their information.
Lifespan has developed many privacy practices to comply with the HIPAA privacy rule. All employees need to be aware of these and to follow them. The privacy rule gives patients certain rights, like the right to find out how Lifespan uses their medical information, and in some cases, to restrict the way we use the information. The privacy policies are located on the Corporate Compliance website, which can be found on the Lifespan intranet, and we encourage all employees to refer to these frequently.
The Lifespan Corporate Compliance Program conforms to the United States federal sentencing guidelines. Therefore, our program is designed to ensure that compliance is a continuous activity, involves all employees, and includes board of directors and executive management oversight. The Executive Corporate Compliance Committee includes executive management leaders from each Lifespan partner. Committee members review the corporate compliance plan and annual report, approve the compliance and privacy rule policies, and support compliance staff efforts. Lifespan's compliance officer reports to the Audit and Compliance Committee of the Lifespan Board. The compliance officer is responsible for daily corporate compliance program oversight and for reporting compliance infractions to the Board of Directors, the Executive Corporate Compliance Committee, and regulators. The corporate compliance program is fully supported by executive management, and every Lifespan employee plays an important role. As a Lifespan employee, you can help ensure the program's effectiveness. You are expected to understand and comply with all of the compliance policies and to report any suspected violations to your manager or to the compliance officer. Ignoring a potential violation can significantly jeopardize Lifespan and the high-quality healthcare services we all work hard to provide every day.
All of us at Lifespan are responsible for the strength and success of the organization, which is why I wanted to remind all employees and professional staff that our Code of Conduct requires that they report any apparent or suspected violations of policy, laws, and regulations to their supervisor, to a member of the Executive Corporate Compliance Committee, or to the compliance officer. All staff should know that Lifespan has a strict policy prohibiting retaliation against any employee, professional staff member, or vendor for reporting an actual or alleged violation.
Here's Lifespan's compliance officer to explain what action you should take if you suspect policies are not being followed.
To report a suspected compliance violation, you can talk to your manager, contact an Executive Corporate Compliance Committee member, call the 24-hour employee response line at 1-888-678-5111, complete a confidential employee response form via the following Lifespan intranet address, or call me directly at 401-444-4728. Both the employee response line and the email system are completely confidential. When a compliance issue is detected, my staff who work in the Corporate Compliance Department will conduct a formal investigation, take the appropriate steps to prevent a similar occurrence in the future, and document how the issue was resolved.
Information about Lifespan's corporate compliance program can be found in the attached program guide or accessed through the Lifespan intranet. Every employee is asked to periodically review the Code of Conduct and the various compliance policies.
The work we do has an impact. Whether you're a physician, a nurse, in transport or information services, you contribute to the Lifespan mission of improving the health of the people we serve. One way to ensure the success of our mission is by helping us comply with the federal and state rules and regulations that guide us. Thank you for taking the time to watch this video and for your continued commitment to the well-being of our patients and the success of our healthcare system.
Please review and acknowledge your understanding of the Code of Conduct on the attached page. Thank you for your cooperation.